here is your question. Where is it? Right. So if you have read and understood, considering its surgical pathology station, kindly please tell me what is the provisional diagnosis that you'll consider for this patient?
For this patient, my provisional diagnosis is maybe patient is in disseminated intravascular coagulation, DIC.
Okay. How would you describe or discuss the pathogenesis of this condition?
For this condition, first of all, patient is a trauma patient, and
Yes.
um, sorry, ma'am.
Yes. Continue, please.
Yeah, patient is in trauma is a trauma patient, and there may be massive bleeding also, as patient had to wait for a couple of hours before surgery, and patient is known case of hepatitis C also. She may have pre-existing coagulopathy also, and moreover patient was transfused blood in OT. Though it's not mentioned here that massive transfusion is has been undergone or not,
Yes.
but there is a chance of massive transfusion also, and that's a common factor for DIC also.
Okay, first, can you please define the term disseminated intravascular coagulopathy?
It's a pathological consumption coagulopathy due to activation of coagulation along with fibrinolytic pathway, leading to a formation of microthrombi in different organs with consumption of platelets and clotting factors. And this is characterized by widespread hemorrhage also.
Can you discuss patient is already known case of hepatitis C and now has undergone trauma? How would that affect the count of platelets in that patient?
Uh, there may be platelet count may be decreased
Decrease, yes.
as
Okay.
there is pre-existing coagulopathy,
Yes.
and if DIC occurs, then there will be consumption of platelets.
Yes.
That will also lead to decreased platelet count.
Good. Okay. Can you tell me from where these platelets are formed in the body?
Formed in the bone marrow from
Yes.
megakaryocytes,
Yes.
the precursor cells,
Yes.
under the effect of thrombopoietin.
All right. That can also lead to, okay, because of the deficiency can lead to bleeding tendency in the patient. All right. Can you please tell me how would you determine if patient is suffering from bleeding tendency or not? What test would you do?
I will go for prothrombin time
Yes.
and INR,
Yes. Prothrombin
and
time. How
also
much
the
would
other
that be?
clotting,
Yes.
other coagulation profile, that is APTT also.
APTT. All right. If you'll do the APTT test, this will work on which pathway? How would you determine?
APTT will check the intrinsic pathway and
Intrinsic
the common
pathway.
pathway.
No, just intrinsic pathway. Okay. Can you please tell me this patient was given? All right. A patient. All right. How do you think that this patient should be managed? Patient is having high blood pressure. What would you discuss about the respiratory rate and heart rate?
Yes. As patient is a trauma patient, I will go
Yes.
for ATLS management
Very good.
and go for ABCD approach,
Yes.
along with simultaneous resuscitation also.
Yes.
As a patient has suspected DIC, I will simultaneously, along with the ABCD protocol, I will go for blood product transfusion. Um, most likely, most likely fresh frozen plasma, and if required, cryoprecipitate can be given also, and platelet transfusion can be given also.
Okay. Which product can you give without bothering about without worrying about the cross match or hypersensitivity reaction? Which blood product is
Without
safe to give?
here platelet transfusion.
Okay. Do you think would that be okay to give packed RBCs, red blood cells,
Yes, but we need to do cross match
for that? Okay.
beforehand.
Which
Yes, ma'am.
cross matching test would you do before blood
ABO blood
transfusion?
grouping and RH typing.
Okay, ABO and RH. All right. Can you define the term hypersensitivity reaction?
Uh, yes, hypersensitivity reaction. Here, in case of blood products, if there is pre-existing antibody in the donor, in the recipient blood, it will react with the donor antigen present in donor blood.
Can you
That will
give example of delayed hypersensitivity reaction? In which conditions do
delayed
you see that?
hypersensitivity reaction is a hypersensitivity reaction that is caused by um, a T cell.
Yes, T lymphocytes. Can
T
you mention the
lymphocytes
time?
within uh, 2 to 3 days after
Yes,
uh,
yes,
exposure.
yes. All right. Okay, can you please tell me in that condition, what are the antibodies or antigens which are released?
Antigens, it's a T cell mediated
T-cell.
hypersensitivity reaction.
Yes. So, all right. Can you also tell me, right, how would you define, all right, okay, you've already told me, but not, right. Okay. This one, okay, when considering or giving blood transfusion, how would you determine how much blood should be transfused to the patient?
First, according to the ABCD protocol, I will give 1 liter, uh, oh sorry, blood products. At least I will keep ready 4 units blood product.
Yes,
And first of all, I will give crystallite fluid uh, uh, at the starting of resuscitation. And then if patient is not responsive, I will start the blood product.
yes. And
Um,
what else would you consider?
I'll also consider the response from the fluid challenge.
Or if there is any active bleeding,
Active
because
bleeding, yes, ma'am.
yes,
If there is any
so
active bleeding present or not.
yes, so that also you have to keep in your mind. Okay, good. Thank you.